What lessons can medicine learn by listening to those who live it every day? What happens when patients advocate not just for themselves, but for others like them? The stories that shape the future of healthcare are the stories we tell today. This is the Patient Perspectives Podcast. Hello, and welcome back to the Patient Perspectives Podcast. Today, I'm joined by an incredible guest, Nancy Muir, who is a pediatric physical therapist in Denver, Colorado, where she specializes in motion analysis and helps plan treatments for children who have challenges walking. Nancy was diagnosed with hip dysplasia in her early 30s and has undergone more than a dozen related orthopedic surgeries since. Her personal experiences inspired her to get involved with patient education advocacy and awareness work and founded Miles for Hips as a result. Nancy feels strongly that patients should be active and engaged in their healthcare teams and has presented on these topics at professional hip surgery conferences. She completed her Doctor of Health and Exercise Science in 2023 and recently published her dissertation research, which learned about patient decision-making for periacetabular osteotomy, PAO, surgery. She hopes to continue this work and develop decision-making tools to help patients and surgeons with this decision. In her free time, she enjoys spending time with family and friends, traveling, hiking, running, walking with her dog, and recently started indoor rock climbing despite her fear of heights, which what a fun activity that is. Welcome to the podcast, Nancy.
Thank you so much for having me, Lauren. This is fun.
Can you start by sharing about yourself, your personal experiences and journey as a patient, and any background that would be important for listeners to know?
Sure. And it's been a long journey, so I'll try to tell the abbreviated version. But and you summarized it pretty well. But basically, I was diagnosed with hip dysplasia back in 2014, and it's interesting because I've actually had the chance to tell my story a few times. And one of the things that a couple of people have found interesting is that I have a background in physical therapy, and people say, "Oh, I just figured you went into physical therapy because of your experiences as a patient and um, in physical therapy." And the answer is actually no. I actually went to PT school. I had never been to an orthopedist before. I had never been to a physical therapist before, but it just seemed like a good career choice for me. So my career choice was actually very separate from my hip dysplasia journey for a while. But I think my background as a physical therapist has really provided me some benefits along my journey as well. And has it's been very mind blowing as a healthcare professional to be on the patient side. And it's something that I've said time and time again that I have learned more from being a patient than I ever have being a physical therapist. Just about healthcare, about the patient experience, the patient journey. And I think, a lot of healthcare professionals, I think we like to think we know what it means to be a patient and the patient experience and that we understand that as healthcare professionals. But when you end up on the other side as a patient, it's really an interesting perspective. But so that's a little bit background. But yes, I was got my hip dysplasia diagnosis in 2014 and spent quite a bit of time, learning about the diagnosis, trying to figure out how I wanted to treat it. I was 31 at the time. I'm sure a lot of your listeners probably are familiar with some of the surgeries, but basically I ended up having surgeries on both hips. I had my the labrum, which is kind of the ring of cartilage around the hip, repaired. I had periacetabular osteotomy surgery, so PAO surgeries on both sides, with basically trying to realign the socket. And I did really well for a while. I actually, one side, I was pretty much pain free for like 3 or 4 years. The other side never felt quite right, but it also, I recovered. I got back to my activity and back to work and pretty much back to life, but just always kind of continued to have issues on that side. And then the other side ended up really going downhill. And it's been a very complex journey since then, pretty much since about like 2019. So about the past 5 or 6 years. And unfortunately, I've undergone a number of other surgeries since then, basically trying to catch up with symptoms and catch up with kind of ongoing issues with the hips, and also now at this point with my spine. So, anyway, yeah, I really have ended up having probably another 10 to 12 surgeries even since then, and have even gotten to the point of doing revision surgeries for a couple of these things. And basically, I'm still in my journey, unfortunately, trying to piecemeal everything together. And but it's been a really interesting journey along the way. Is probably the best word to put it.
It really is a unique perspective to have that experience as a patient while also a healthcare worker. And for me, I kind of had an opposite journey to you, whereas I started as a patient and went into
Mhm.
healthcare because of that. But is there any way that your experiences as a patient have informed how you treat your patients now?
Yeah, absolutely. 110%. And I always say, like, I like to think I was a good physical therapist before, and that I was a compassionate and, healthcare provider. But, um, yeah, having that insight really has impacted my practice. I think, both through my personal experiences as a patient, and then also kind of how I've evolved also as a researcher in this area, as a student researcher, and then through some of my awareness work and advocacy work, and just as I've met more and more patients. But I work in pediatrics, so it is interesting. I mean, you're the expert in this kind of stuff because you've grown up as a patient, in the healthcare system from pediatrics up through adulthood. And pediatrics is interesting because you're working with the child, but you're also working with the family. So I feel like, probably even more of my interactions are more depending on the age of the child, of course, but even more so with the parents or the caregivers. But I think there are certain things that, um I really, really try to make time to give patients and families the chance to tell their story. I am always so focused on the fact of, like, what brings them in. And sometimes they're like, well, I'm here because my doctor said I had to come. But, kind of doing deep diving into it, we use strategies such as like motivational interviewing, but to really, really try to get families and patients to tell their story, to own their story, and to own their care. I'm very, you know, I always one of my questions for families is always like, what is first of all, like, what is your goal for seeing me? I work in a motion analysis lab. What concerns do you have? What questions do you have? What are you hoping to gain out of this experience? And it's interesting because I don't think families are always interested in being asked in that way. So, anyway, I think first of all, just letting the patient and family share their experience, express their questions, express their concerns. Um, I think another thing that I really do is, I know one of my frustrations as a patient has been just that sometimes you get into these systems and like you don't have one single person who can help coordinate your care. Now, I'm not going to be coordinating anybody's care, but if I can take extra steps to try to help that process, I will. Also, to give, like, the hardest part, if somebody says, if you're waiting for a callback and you don't get a callback, like things like that to me as a patient are so stressful. And it's something that I really try to do for my patients and families. So even things like I always try to give like a projected timeline. Okay, you saw me today. Here's here's what happens next. Here's I'll give you a call once we review your data as a team. That probably is going to be in the next 3 to 4 weeks, and I always give them my phone number. I give them my email. I give them encourage them to have my chart messenger. And I say, don't hesitate to reach out to me. If you go home and you think of a question that you didn't ask or something, I always say, I'm your representative here. If there's something that you want me to share, on behalf of you, if you have questions, let me know. And I will, make sure to follow up with you. Even if you just want to reach out and be like, hey, Nancy, I know you said it was going to be like 3 or 4 weeks. It's been 3 weeks. Where are we in the process? I'm always like, don't hesitate to reach out. Like, I invite that because I think that waiting for a plan, and I mean, Lauren, you probably know more than anybody how how healthcare works. You get into it and it's, you don't just show up in a doctor's office and then have a plan and you're in treatment in a month. Like, it's oftentimes months that you wait to get in for the appointment. They may maybe recommend more imaging. You go to do that. It's more months to get in. You finally, maybe, if you're lucky, have a treatment option if you're not going to get multiple opinions. And then, if you're going to schedule surgery or something, it's going to be 3 or 4 months. Or they say, well, go try physical therapy for 6 to 12 weeks but I think inviting people to stay in touch and to use you as or to use me, I should say, as a resource. I try, families have a question. I go, listen, I don't know the answer to that, but let me see if I can reach out to another team member who might be able to help you with that. Because the worst thing too is when somebody's like, well, I don't know. And then you're left hanging. So I think though, like just probably the communication piece, if anything, for me, first of all, inviting the patient and family to participate in the communication piece is a big part. And then how I kind of circle back on the communication loops. And then I think the other piece that's a huge passion of mine is the decision making, is really validating patients and families and really helping them understand that this is their lives and they're in charge. And it's okay if they have questions, it's okay if they have concerns about a treatment plan, and that they need to do what's best for their family. Sometimes I'll have families come in and, like an example, we were talking about braces before, right? Like braces that a child might wear on their leg to help them walk. And I'll have a family come in and, the child's going, yeah, I'm not going to wear a brace. I'm a freshman in high school. Kids make fun of me. They ask me why I'm wearing a brace. Like, I refuse to wear a brace. I can look at all the data in the world and say, wow, you're walking. If we're looking at typical walking patterns and efficient walking patterns, your walking is a lot more typical and it's a lot more efficient when you wear your brace. But psychosocial health of a child is also, or teenager, is incredibly important. So if a child or a teenager doesn't want to wear a brace, I mean, we can provide education, we can provide data, but we also might have to start thinking what other options are there? Are there different kind of bracing options that are less bulky or obvious? Are there different other like devices that could be worn to help? Are there different therapy activities that could be done? Do we talk about a different kind of prescription? Like, hey, listen, don't wear your brace to school, but maybe wear your brace when you go when you're doing really long distance walking, like if you go at the airport or something. So, I think there's a lot of room for that decision and really empowering patients and families to be like, no, like ask the questions that you need, make the plan that makes sense to you, discuss with your team. Yes, there are some interventions that are timelier than others, but for the ones that aren't timely, don't need to be done in a certain time frame, do it when it works for your lives. Like learn about what you need to do. So, sorry, that's a long answer, but yeah, I would say those are some of the things that, have really impacted me as a patient, that I've learned a lot about through my research and interactions with other patients, and that I really feel are not always met in the traditional healthcare system, and that are things that I feel like if I can do that for my patients and their families, that's a meaningful role for me.
Absolutely. And I think it's so true that kind of circling back a little bit, there are so many factors as part of the healthcare system and like how the system is set up as a whole that we don't necessarily have like control over that make the patient experience very frustrating. And so to know that they can go to you and really like have a partnership in you and you can be a resource to them, I think that can really change the way that patients experience their health care, and it can feel more personal and really feel like they are not lost in a system that it is very easy to feel lost in. I wanted to kind of going off of your experiences as a patient as well. I know that your long journey as a hip patient inspired you to create Miles for Hips.
Mhm.
Was there a moment where you identified a reason where you wanted to create Miles for Hips, and how does an organization like that work to improve patient experiences with hip dysplasia, especially fostering a sense of community?
So Miles for Hips, actually, it's so interesting because it's not what it was intended to be in the beginning. So really, this was back in 2018. I was at this point, doing pretty well in my hip journey, at least on one of my hips, and the other one was tagging along. My background, as far as is, I've always been a very active person, and historically have been a long distance runner. And in graduate school, I kind of transitioned from doing marathons, which I thought was pretty long distance and the epitome of running. But then I ended up going to ultra marathoning and specifically
Wow.
like trail running. So anyway, that's kind of my background passion. And I've done, I think to date, I've done like 38 marathons or ultra marathons. And so anyway, I one of my goals, I mean, I since probably I was like 20 years old, one of my dreams was always to run a 100-mile race. Like that was just something that was a life goal. And I always said, someday I'm going to run my 100-miler. And life was busy, grad school, new jobs, things like that, and I just never quite had the opportunity. And then I had my hip dysplasia diagnosis, and it was a little bit of just going, well, first of all, nobody even can, it's very unclear whether or not you can even run after hip surgeries. There's a lot of debate about even if you can, should you, and then physically, would I be able to do that? And so I underwent these a couple of surgeries, and I literally remember, like, I woke up from my second PAO like in the recovery room, and just my mindset was like, okay, that's done. Time to start thinking about this 100-miler. So I literally like started training on my crutches, just crutching up and down the street, and was going, this is my 100-mile training. And I set kind of an arbitrary goal of like 2 years post after the second PAO. And so anyway, I got to the point where I was like, okay, I think I actually can do this. And anyway, so I started training for it. And I think it is funny because it really was kind of born out of some guilt or uncertainty where I was like, well, I'm not sure this is actually really good for my hips. But if I'm going to possibly destroy my own hips through my 100-mile quest, maybe I could do something good for hips overall. So I was like, well, it'd be really cool to use this experience to raise awareness about hip dysplasia. And I thought maybe there's a way to like support something related to hip dysplasia. And it was I actually had looked at one point at like some GoFundMe pages and stuff like that. But so many times those forums, I was like, first of all, it's a little weird to have people just giving me money. And they'll take a bit of the cost, like if a donation, they get a proceed to it. And so anyway, I ended up reaching out to the International Hip Dysplasia Institute, who I was well aware of, and I told them who I was and what I was doing. And I said, hey, I'd love to fundraise for you. What do you guys think? And they thought it was a really cool idea. And they were like, well, what can we do to help you with this? And I was pretty excited. I was like, oh wow, you guys want to help me with this? But I just said, right now I don't really have like a way to raise money, and like a forum to raise money and to like share my story on. And if you guys could help me with that, that would be great. So they had a gentleman who worked, I think, with their IT department, but he basically built me a blog. But he embedded into it a link to the International Hip Dysplasia Institute so that if people wanted to support the effort, they could make a donation directly to HDI. So anyway, that was really great. So I did my thing. I trained for my 100-miler. I ran my 100-miler. I ended up, it was really fun. I had a team. When you're running these long of races, a lot of times you can have people join you for parts, like segments of the race, which is especially helpful at nighttime because you're literally running in the middle of the night and you haven't slept, and your headlight, you start thinking everything's like a bear. And so anyway, I actually finished this race. And once I did, someone from the International Hip Dysplasia Institute, he was the director at the time, Andrew Younger, he also was a runner. So I think he thought this was especially a neat project. And he reached out to me. He's like, oh my gosh, Nancy, that was so fun. What's your next race? Like, we want to keep working with you. What's your next race? And I was like, oh, Andy, I think this is going to get a little old pretty fast. I said, first of all, I don't know how long I'll be able to run for, but also I can't keep running around asking people to support hip dysplasia. So, but I had always kind of had this vision that, I really feel strongly about this concept called like participatory medicine, which is basically the idea that you really need partnerships between healthcare professionals and patients, and also like institutions, but that really healthcare can be optimized when you get all of these perspectives together and when you really have this partnership. And I felt like there really weren't a lot of opportunities for that kind of partnership. And, the International Hip Dysplasia Institute, when people, I knew other people who had reached out to them, kind of with an idea of being like, oh, or can I do a fundraiser? But they didn't get the same response as I did. And I don't think it was that there was anything wrong with that, but there just was no channel, to take on volunteers, so if people weren't coming forward with like a big idea that could be propagated forward, I think, they didn't really have anybody with that avenue to like get patients truly involved. They had some story pages, but so I talked to Andy and I was like, listen, I've got this vision that um, where of really trying to get patients more involved in healthcare and being present at the meetings, being represented in the research, so being helping to develop the educational materials. Patients know what patients want, and that's something that you can think you know what patients want, but until you're a patient you don't really know what patients want. And I also was like, gosh, and if we could have an avenue so that like if other people come up and want to be get involved with advocacy and awareness work, that there's kind of a forum for them to do that. I said, you guys did that for me, and that was so amazing. And if there's a way that we can kind of fill that niche there. So Andy actually thought it was a great idea. And it was funny because when I had done my blog, the guy who developed the website had asked me, he's like, well, what do you want to be called? And I think I came up with a list of like 6 names, and Miles for Hips was one of them. But there were other ones on there. Like I live in Denver. I think I had like Mile High Hips was one of them, or Miles Blogger. I forget. There were different, but a lot of them were running acronyms. But the gentleman who designed my blog, I sent him the list and he was like, oh, I like Miles for Hips. And it was so interesting because if he had chosen any other name on the list, it probably wouldn't have worked. But because of the name he chose, I was like, man, miles are so metaphorical. Like, the idea of like your life and your journey and the miles that you log in different ways, and thinking about how, hip dysplasia is a journey, and healthcare, being a patient is a journey, but all the journeys we take in life as, you know, friends, family members, parents, caregivers, students, teachers, all of this, we all have our journeys. And so anyway, it just really fit. And that was basically the evolution. And then, I definitely knew it was something that I wasn't going to do on my own, but I started pulling together at first a pretty small board of other patients who I knew, and we really just developed from there.
That's great. And how can an advocacy organization like Miles for Hips help to bridge that gap between patient and providers and promoting better communication between patients and providers?
Yeah, that's a great question. And I think, well, and actually, Lauren, I should sit back that like one of the things that really inspired the idea of what I presented it to Andy, and actually also at the same time, I was a researcher, I was a postgraduate student, and that kind of inspired with that, is that through my hip dysplasia journey, um, I I got to know a lot of patients, and a lot of that was through social media. And it's funny because like if you had asked me before 2014 what a blog was, or what a like Facebook group was, or I mean we didn't have Instagram and those things back then, but like I would have never known. But I actually remember the night after my diagnosis, I think I was Googling hip dysplasia and I ended up coming across a patient blog. And it was so cool because it was the first time I had like found somebody else like me. And I read her blog, and I think she might have alluded to the PAO Facebook group, which is a huge, you and I have both been involved in that. It's a huge social media support group that probably has close to 10,000 people at this point. But I think when
Mhm.
I joined, it was maybe 1,500. So I mean, it's exploded, and but there's a number of groups like these. And I think what I got fascinated with, first of all, I used it a lot as a patient, but I think part of me as a medical professional and also as a researcher got a little discerning about a lot of the information on there. And I said, it's interesting because there is a lot, like there's some really great information on these sites. There's also not a lot of great information on these sites. There's a lot of misinformation on these sites. There's a lot of things that are being presented by patients as facts that probably are are true for their unique case, but maybe the patient doesn't realize that it's nuanced and that even though it's the right information for them, it actually doesn't apply to all other patients. And I think one of my like most pivotal moments was I just remember one time a patient putting a thing out into the social media world, and she was like, I okay, okay, group, I went to see Dr. So and so and he's recommending this. And I went to see Dr. So and so and he recommends this. And then I went to see Dr. So and so and he recommends this. And then I went to see Dr. So and so and he recommends this. And it was for, at the time, it was four of the surgeons, it still are ones that you'd be going, those are kind of the top echelon of PAO surgeons in the country. And the person goes, but there was four different opinions. And
Mhm.
the person's bringing it back to the Facebook group and going, what do you guys think I should do? And I thought that was so profound. Sorry, the dog's barking. But I thought that was so profound that it's so fascinating that the surgeons are the experts on the patient, the diagnosis, the treatment, the pros and cons of the treatment, the patient's unique health situation. But here was a patient who had sought information, who had kind of done what she probably considered her due diligence of getting multiple opinions, came back with what happens when you get multiple opinions. You sometimes get multiple opinions and sometimes conflicting opinions. And she was bringing it to a group of patients. And I I certainly understand that patient's confusion and aggravation probably and frustration. And I have been there more times than not as a patient myself. But I also, that's probably not the forum for a question like that. But I think it really spoke to the fact that there probably is a lot of information or information needs that patients have or questions that they have that don't get addressed in a clinical encounter with a surgeon. And I think that's a big challenge in healthcare. And it's a big challenge when patients get different information from different sources. And like, how do you begin to sort through that as a patient? And I don't think miles for hips is truly the answer for that, and that's what I've said all along is that, at the end of the day, I think the fact that patients can go to multiple surgeons and get multiple opinions really speaks to the fact that, hip preservation is an evolving field. And you and I have both been to some of these conferences, and if we think patients are confused, I mean, you get to these conferences and there's a lot of debate among the surgeons. So I think, we start to realize how gray a lot of this area really is. But when you have a patient trying to make a decision, they need to be empowered to participate in that care. And if there's not a single best treatment option, which there probably is not, if you can go to four top-notch surgeons and get four different opinions, um, I think there's patients need to know that they need to play a role in this decision and in their healthcare. And I think that's one of the things that we really look to promote through Miles for Hips. And Miles for Hips has a couple different facets to it, but one of the things that we felt strongly, and I know, and we work together, and you're on our education information committee. Um, but one of the things is trying to say, how can we educate patients um, about their diagnosis? And patients go through, you and I know, like patients go through great extremes to get information, and a lot of times information is not accessible. I actually know patients who have like gotten friends who are healthcare professionals and have gotten their logon information to have access to journal articles. And and then even if a patient can access a journal article, which can be challenging to do because a lot you need a subscription fee, even if you can access the information, you know how many, I mean, you and I have both, we've got college degrees, we've got master's degrees, we have working on like post-professional doctoral level kind of stuff, research, background, um healthcare profession, the background as a healthcare professional. And it is so hard. Like, we know how hard it is even when you have all of those skills and all of that knowledge and all of that background. It is still really hard, even when you can access the material and even when you stand a chance at understanding the material. So I think one of the things that we've wanted to do is try to see, can we understand what patients want from an information educational need? And then, first of all, can we provide some resources that are things that, would help patients understand their condition and understand the treatment options. But I think even more so, what we push through Miles for Hips, even with our education and information, is the the idea that patients need to be partnering with their physicians to do this. But if we can give patients the edge of, first of all, giving them some confidence, giving them some background education so that they can take that to the table with their surgeon and participate in that discussion or know what questions they want to ask. Because I think at the end of the day, that's often some of it is that patients, we don't even know what we don't know. We don't know to ask what we, how do you ask a question when you don't know that you need that information? So I think that's where we try to help people through that.
One thing that I'm most impressed with Miles for Hips, and something that I've talked about with my surgeons as well, is just that education and information aspect where we're bringing incredible resources to the community that patients can reference, and they can then take that information and have knowledgeable conversations with their teams about it, to
Yeah.
kind of bridge that gap between because it can be difficult to have conversations at like maybe a first or second appointment that you have with a doctor because it's overwhelming information. And so to be able
Yeah.
to go home and to find information that you can more easily more easily understand rather than going to a research article, like finding it in a more patient-friendly and accessible way, and then
Mhm.
saying, okay, this is what I understand from it. These are my questions, and then going back to your team. I think it just helps kind of bridge that gap and it makes the information gap and the misinformation surrounding hip dysplasia and treatment a bit less.
And I think one of the things that, and I would say with Miles for Hips, we have a couple different facets, and the education and information is probably the one that historically I've been the most passionate about, but it's also been the hardest to develop. And part of it is, being able to get the materials, out and ready to share with patients. And I think one of my big concerns has always been around the fact that I want to make sure that Miles for Hips remains as or is known as a highly reputable source of information. And I don't even want to say a misconception because I think there is a truth to it, but I think there is a perception that patient to patient information is not accurate or not valid. And that's not true. I mean, you and I both know there are a lot of patients out there who understand a lot of this really, really well. But I do think there's a lot of misinformation being shared. And I think that's been something we fought really hard to make sure that, lots of checks and balances, like, is everything that we're sharing truly as accurate? Is it also common to the entire population? Or I don't say, I should say the entire population, but, we want to make sure that we're not promoting um, like right now, like one of the controversial topics in hip preservation with especially PAO surgery is, do you repair the labrum or do you not at the time of surgery? And there's some
Mhm.
surgeons who strongly believe, no, just do the PAO, the labrum will be fine. There are other surgeons who do a labral repair or a scope with every single PAO. There are a lot of other surgeons who are like, I think it's a case by case. And there was just an interesting article, that came out that did a randomized control trial and actually says maybe we don't need to repair the labrum. But even when you listen to the experts talk, I think there's still a lot of nuance of being like, maybe, maybe not. Maybe there's some patients who still really need this, and I do think a lot are going to continue to take a case by case approach to this. But so it's one of those things with Miles for Hips. We certainly don't want to jump out there and say, hey, this study says absolutely don't repair the labrum. If anybody's out there repairing labrums, don't go to that surgeon. That's bad. There's so much nuance. I think it's important for patients to understand this is actually controversial. So if you go to a surgeon and the surgeon says, yeah, we're going to do a labral repair and a PAO, I think it's important for patients to know that that might not be the standard of practice across all surgeons. But we certainly don't want to come across saying this is the one right way when there might be variation in practice for different reasons and different, whether it's regional, cultural, um, theoretical, philosophical. So that's something we've been really big on doing. And one of the things that makes us unique, I think, is that somebody, we've always had a surgeon or another specialist serve in our medical. We've historically had a medical advisor. We're transitioning to more of like a medical review team this year. Um, but have had people to look at the materials that we're sharing and to be able to kind of give it a check that, yeah, this is actually in line with general practice, and seems appropriate for patients to have this access to this, and this seems like a fair and reasonable and accurate representation of the material or summary of whatever it is that we're sharing.
Yeah, and I think when there is so much information out there, especially the conflicting information on, the appropriate treatment, that can kind of muddy the waters with like shared decision making, and it can,
Hmm.
make it a difficult process, but ultimately I think that's when the medical team comes in to say, you want to feel confident with number one, your medical team, but then also be able to have a conversation to
Hmm.
feel like you are making the best decision for yourself, even when there are like multiple options on the table. And
Hmm.
you wrote your thesis on how shared decision making can be enhanced for PAO surgery. Can you
Hmm.
speak about how you chose that topic and what you concluded for your thesis?
Yeah. So I actually started my postgraduate program back in 2014. So it was really funny because I think I like applied for it a month before I was diagnosed with hip dysplasia. And the advisor I was matched with, her background was looking at running mechanics in children with cerebral palsy. So that was actually supposed to be my research topic. And I won't go through all the details, but long story short, I had a very supportive program, and they ended up giving me some leeway with what I wanted to research. And I think when I really got interested with the topic was really around the time of my second PAO, and I really struggled with the decision making. For me, there were a lot of factors that just made it a very challenging decision. And I think because of that, I got very fascinated, um, partly from like my own perspective or my own need, but also just kind of from a nerdy research perspective, that I loved like seeing other patients who, you'd meet these other patients on the Facebook group, and some were very much like, I know I'm doing this, and this is like they just were so confident. And there were others who were like me, who were like, I have no idea what to do with this. And I just thought it was really interesting. And I got really fascinated with the idea of like, how do patients make decisions, and especially around this surgery. So I ended up doing a qualitative research study, which was really neat. And I got to, with you do qualitative research, you're working with the group you want to study. So I actually interviewed 15 patients. And if you could imagine, I mean, I got on the phone calls with these patients. I mean, I think my shortest interview was an hour and my longest was like 2.5 hours. And even when we stopped the recording, people just kept talking.
Hmm.
And it was it's just a population of people who wanted to share. And so anyway, I really explored decision making from many facets. All the patients I did interview had PAO surgery. So certainly, my research doesn't represent people who made the decision not to have PAO surgery. Like there's a lot of different elements to it, but I really wanted to understand, for people who decided to have the surgery, how did they go through that process, and what got them to that process, and what was the experience of that process? And really, my research, when you do qualitative research, your analysis is very different. You're not plugging in numbers and having something spit out that's, a number that go, okay, it's either significant or not significant. When you do qualitative research, you're really going through this whole process as a research team to basically come up with like themes, or trying to understand deeper trends that are kind of carried across the participants, so you can understand what it is you're studying. So for me, I really found that like patients had mixed experiences. I had a couple patients who felt very, confident about their decision to have surgery. I had others who, I mean, I even had people like getting wheeled back to the emergent, to the not the emergent, the operating room, being like, am I making the right decision? Like really, really, people who were strongly conflicted about it. And ultimately, though, I found that there were a couple of things that really seemed to help decision making. And people who had greater confidence in their decisions, and also generally like greater satisfaction with their experience, had their information needs met. So they were able to like understand, what is it that I need to know to make this decision. And some of the information needs had to do with their diagnosis, what a PAO surgery is, what are the other treatment options. But some of the information needs were like, you know, how long am I going to be out of work? How long do I need someone to take care of my kids? How am I going to care for my dog? How am I going to, I'm a student, like, do I need to wait till after graduation, or can I do this during winter break? And so, there were a lot of kind of logistical things that people needed to know too. Um, Another element that really helped was when patients were able to identify basically like when their goals for the PAO, or when their preferences around surgery and all that, when it aligned with what were the intended outcomes were. So I found things like if a patient, like I had a couple patients who just at the end of the day, they wanted to keep their native hip. Like, that was their goal. They just said, "Yes, I want pain relief," which you can get pain relief a lot of different ways. "Yes, I want better function." You can get function a lot of different ways. But if they could say, "At the end of the day, my number one goal was to keep my hip." Like, I didn't want a total hip. I wanted to keep my hip. Like, those patients had an easier time making a decision, because like no matter what kind of conflicting information or what else came their way, they could say, could kind of bring it back to this as their number one goal. Um, and then the final thing was really like, was the patient's preferred decision making, were patients included in the decision to the extent they wanted to be included? And it was so interesting because I, as a patient, I'm definitely like oh, I need to be included along the entire way. And I'm very big on like, I need a medical team who is going to partner with me. We're going to exchange, information. I'm going to be able to ask my questions. And ultimately, I'm probably going to choose my own intervention, regardless of what I need a team, and I need a surgeon who's confident that what we're going to do and my decision makes sense. But that's me as a patient. And I think I kind of was biased to thinking that, isn't that what most patients are going to, or, that most patients are going to want to have that kind of role in their decision, to either be the decision maker or have this very intertwined, shared process with their surgeon. And many patients did. But what was really interesting is I had a couple patients who were just like, I just wanted my surgeon to tell me what to do. And they kept bouncing it back to me and saying, "No, this is your choice." And they were going, "How on earth do I make a choice like this? I mean, I just don't have the information. I don't, like, I really need them to give a clearer, like, yes, I think you should do this, or no." And I also alternatively had other patients who, like, the surgeon told them what to do, who was basically like, "Oh, yeah, you need a PAO." And for a patient like me, that would be uh, pretty abrasive, and I probably would walk out of the office and never come back. But I had some patients who were like, that was like, I had so much confidence. I love that I walked into the surgeon. They knew right what was wrong with me. They told me about it. They gave me the information I needed. And they said, "This is what I think you should do." And for some patients, that was so that they loved that confidence. They felt very comfortable. They liked the surgeon, and they just were like, that was perfect. So it was interesting because, whereas that would not have been a good fit for me, for other patients, that was their preferred. And so they had a great experience around that. And so basically, at the end of the day, I think that alignment of, are you going to participate at the level that you want? And do you have the information you need and to do that with? So yeah, those were kind of my big takeaways from it.
That's really neat to hear, and I think
Yeah.
it speaks to like the individualized aspect of medicine
Hmm.
and
Yeah.
to like really patient-centered care. How can you be truly patient-centered if you're not understanding the ways that your patient likes to receive information, the ways that your
Hmm.
patient, likes to decide on a treatment or to navigate their treatment and things like that. So I think that's
Yeah.
such an important thing to highlight. And going off of that, you also published an article in Clinical Orthopedics and Related
Hmm.
Research in their column, What I Wish My Surgeon Knew, where you shared the story of getting a 39th medical opinion. And
Yeah.
what did this experience, that journey of getting your 39th medical opinion, teach you about kind of the importance of being an active participant in your care?
Yeah, and that, no joke, I got 39 opinions. Now I always tell people, I said, not all those were surgeons. Like, certainly that included physical therapists, included physiatrists, it included pain management, included regenerative medicine. So there were multiple players in there, but probably half of them were surgeon opinions. And I think, I mean, this is an entire conversation on its own, but I've had the conversation with a number of patients that, for those of us, and I would say the Miles for Hips, like many of our fellow board members, kind of fall under this, and I say is that, I think it you do end up kind of hanging out in this realm when you're what I call like a complex orthopedic patient or a complex hip patient. And medicine, and I don't think that needs to be a clear definition, but just to say that it's really challenging the further, the more complex your journey gets, or the more, the further you get along the line, things get really challenging because you might do a surgery that is supposed to take care of the issue. And then when it doesn't take care of the issue, or when you have a new issue arise, then suddenly things get complicated. And for me, one of the challenges was that when I went to these different opinions, if I had gone to two doctors, two surgeons or three surgeons even, who all kind of said, yeah, this is what you should do. Yeah, this is what you should do. Yeah. And if it all was matched, I would not be going to get 39 opinions. What happens though is that, I was going to all these really smart people. Like, these are good surgeons, smart surgeons, and getting very, very, very different treatment recommendations. And I think one of the challenges that I know I've felt personally, and I know some other patients I felt, or I've talked to has who have had similar journeys have also expressed or felt, and I've even been told directly, is that there's almost a critique of that in the medical world, which I do understand. Surgeons, but I kind of go, I've actually I had a surgeon once tell me, he's like, you're a red flag. He's like, I'll treat you, but nobody else is going to treat you if you don't stop getting opinions. And I've had other surgeons make similar comments of like, stop getting opinions. You're just confusing yourself. And I go, well, yeah, it's confusing, but yet not one of those surgeons, once again, I go, gosh, I got 39 opinions, 20 of them surgeons. Not a single one of them took the time to say, wait a minute, let's sit, like, you've gotten a ton of opinions. I can tell you what I think you should do, but at the end of the day, you need to tell me a little bit more about why you're getting all these opinions, because I never got the chance to share. Listen, every single one of them is different. So how do I know which one's really right for me when I'm getting so much conflicting information? And I think I'm just grabbing at whatever I can to try to build as much information for or against an intervention. And when these are coming from very, very, very well known, very intelligent, I mean, just it does get very complex, and it got very challenging. And that was kind of my piece, talking about my 39th opinion. And that you and I both know Seth Leopold. He's the editor of CORE, the Clinical Orthopedics and Related Research Journal, and he has this column which I think is really, really great. But he does invite patients to share their experiences. And really, though, he invites patients, the what I wish my surgeon knew, a couple of the prompts are, talk about an experience of like misunderstanding or miscommunication, um, really trying to pull out that negative. But he said also, I forget what the other prompt is, but a kind of an experience that stood out to you as kind of an exemplary experience. And I decided to write about that. I think, for me, it was just a little bit more of a positive piece to write. But I talked about my 39th opinion. And it was really great because this surgeon, I was his last patient of the day. I was so used to being blown off by surgeons or being rushed out of the office. And I think I just was so anxious for this guy to come in. And I was so nervous that, he was just going to be like, I don't know. I don't know what's wrong with you. Like, or just to throw a random diagnosis. And he came in and he apologized for being late. He sat down and he really took the time to hear me out. And, I mean, it was probably a 30-minute appointment. It might have even been a 45-minute appointment, but it was like one of the like most incredible healthcare experiences I've had, because even some of the things that he said, he was like, "You've been through a lot." He also acknowledged, "You know a lot." He's like, "You know a lot about this stuff." He's like, "You can have a conversation about this stuff with any orthopedic surgeon in the country." He's like, "You deserve to be listened to." And whether or not you have that knowledge, that experience, whatever, have a healthcare professional say that you deserve to be heard is just mind blowing. And what was really interesting is he actually disagreed about the treatment that I was going to pursue. and I wanted to have an osteotomy procedure. He thought I could probably get away with a revision arthroscopy procedure. And we talked about it. At the end of the day, he finally just admitted, he's like, listen, he's like, I think my big takeaway is I just said, listen, my problem is that I work in a physical career. If I do the arthroscopy procedure and it fails because we really need the osteotomy, I was like, I have to wait a whole other year to be able to build up the time to go out of work again. And I said, so honestly, if there's a chance it needs to be done, I'd rather do it because to me, it's one recovery and I can be back at work and not worry about having to be out for more surgery. And it was really interesting because he was like, listen, he's like, at the end of the day, once again, I don't think you need that procedure. But he also said, but I can't tell you that for certain, yes or no. He goes, your numbers fit into the realm where, yes, it might be helpful to have that. He goes, I can't tell you for sure. He goes, at the end of the day, he goes, I understand your reason. And he goes, yeah, wish you could take the time to just try this and then maybe avoid that second surgery. But he's like, if you need to get that off the plate, like mentally, physically, financially, everything, he's like, I'll respect that. And that makes sense. And like that was a really cool experience too, to actually have a disagreement about, but to have a surgeon who actually was like, listen, it's not like you're talking about some unreasonable, like crazy thing that doesn't make sense. Like, yeah, at the end of the day, this is gray. And I can't tell you with 100% certainty how this is going to play out. And it sounds like what's important to you is to have one recovery. And if that's what you want to do, I'll support it. So anyway, just kind of going back to those discussions of what profession, healthcare professionals can do during those patient interactions. I mean, I've told him too, and I think I wrote that in the paper. I was like, at the end of the day, I mean, he gave me a nice amount of time, but at the end of the day, this is like minutes of his entire career. And taking those minutes with me and just saying those right things changed my entire experience. And it's just amazing how just words and how we say things or how we ask things can totally change a patient experience.
It's so true, and it can be really impactful and can inform the way that you go about future medical interactions as well. So I'm going to put a link to that with the podcast information so that other people can read it, and I would absolutely encourage it. I thought it was just so powerful when I read it. Again, a lot of things that patients and providers can take away to better include patients in their care and better address the ways that us complex patients often feel, because it can feel the language that you use makes a difference, right? And to be called a red flag is really
Mhm.
stigmatizing and hurtful, and
Yeah.
it could make patients not want to continue to pursue care and to follow up and get the care that they really deserve. It's so touching to me, and I know that other patients who have had long healthcare journeys, hearing all of that and knowing that there are doctors out there who will take the time to sit
Mhm.
down and listen and give you the time and the space that you deserve. And also acknowledging and respecting your expertise as a patient. I think that's a huge
Yeah.
thing. Considering your professional background, but also the fact that you had seen so many other doctors and you did your research and you were an educated and informed patient, and he valued that.
And I will fully acknowledge that, I often say that that complex patients don't fit well into the medical system. When people are blocked out, I mean, I get it. I get why this is challenging and I get why this is hard to do. And I get why this, if you have 15-minute patient blocks and you have someone like me walk into the office, like a 15-minute block really is not appropriate for the amount of things that I need to cover.
Right.
But so I recognize that there are challenges, and I think, so I know this is easier said than done, right? Like there's the ideal world, and then there's the realistic world, and recognizing that surgeons are often, you know, kind of overburdened in documentation and surgery schedules and clinic schedules and responding to messages. Like I understand that that's taxing. and not always feasible to be able, you can't give every patient 30 or 45 minutes. I mean, ideal, yes, it would be lovely, but you can't. And I think that's where, some of my shared decision making work, some of the things I'd like to do in the future, even through Miles for Hips, you go, okay, if patients could get the information elsewhere and could have their list of questions and go in and go, okay, I actually don't need information on this, or this. What I need to get out of this appointment is this. Then you actually could do a 10 or 15-minute visit, right? But if you take 10 or 15 minutes going through stuff that doesn't, you're not able to get to what's really important for the patient to have, then it hasn't done justice. But I do think there's interesting ways, like, can we get more education and information shared in different venues so that people can go into these appointments with this? Because that's always been helpful to me. Are there decision making, like tools or resources that patients could do outside of the visit that they could bring to the surgeon? And it's like, okay, I've actually worked through this worksheet. Here's all the things I understand. These are the couple of things that I need to know to make this decision. Like, is there ways to do that to try to expedite these visits? My surgeon, that surgeon who I was talking about, he's told me point blank, he's somebody I've seen off and on a couple times over the years. Um, he tells me, he's like, Nancy, when you call to schedule, he's like, make sure you schedule my last appointment of the day. And he's always running like 2 hours late. So a 4:30 appointment turns into, 6:45 by the time I see him. But I know that, and I just bring stuff to do, and I just wait, and I'm patient, and I know that when I see him, he's gonna give me the time of day. But he also recognizes that I'm not gonna fit into his 10:45 slot, and I appreciate that. But I mean, it's an interesting to think of, like, how could the metal, are there different models? Are there different ways to utilize other members of your healthcare team? Like, could a patient leave the surgeon, but then you have a healthcare navigator or a health coach or a nurse or a social worker or somebody else who can step in and help, like, fill in some of these gaps so that all the time with the surgeon is very intentional. It just makes me, yeah, wonder, like, where could healthcare care go with this? And I think Miles for Hips trying to, work towards maybe some of that through some of my research, trying to work towards some of that. But it's challenging. It's not because surgeons, I think, don't want to give that time or attention or space or respect or any of that. It's just that it doesn't fit.
It's
Um,
true. It really is
for the most,
challenging, and I think it's a
yeah,
big conversation that's happening now in a lot of aspects of medicine is that the current medical model it doesn't fit for a lot of patients, and even for
yeah,
providers, it's stressful
yeah,
and burdensome
yeah,
on their end as well. So it leaves us with a lot to think about, and hopefully things to be hopeful for, and how the system might be able to change to better address both ends.
yeah. And I think that's where, just, kind of going back to the big picture of everything, you need to have patients part of that change.
Absolutely, and part of the
Absolutely have to be,
conversation.
exactly.
I think that's what we saw. We went to the Hip Preservation Society
Mhm.
conference this past year, and the ways that they have started to include patients in the conversation, at least related to like understanding more about the patient experience, and kind of how that plays into patient-centered care and shared decision making. So I think
Mhm.
there are positive steps being taken and a lot to look forward to.
Yeah.
Well, this has been absolutely wonderful. I really appreciate you taking the time to be here and to share all of your expertise and your insights and to share your story. I know that anyone who listens to this will learn a lot and will have a lot to think about afterwards. I know that I certainly do.
Well, thank you for having me. I really enjoyed it.